Hi, my name is Ringdahl. I'm doing my video validation on medical administration today. My evaluator is Nate Kokanowski and my videographer is Ben Rogers. So today I'm working with a patient named Jamie Wheeler. The provider's orders are call for digoxin 250 micrograms PO once daily. I'm going to be giving it at about 11:15. It says hold for heart rate of greater than 60. When I did vitals earlier on Jamie Wheeler, I've noticed that her heart rate was at 79, which is why I'm giving her digoxin today. She also is supposed to get an IM injection of vitamin B12, 1,000 micrograms IM, and I'm going to be also giving that at 11:15. That goes to Jamie Wheeler. And of course, Jamie Wheeler is going to get some Levemir. She's type 2 diabetic, so I'll be giving her 10 units of Levemir subcutaneously once daily at 11:15. And I'm going to be giving that to her in most likely the right upper quadrant. Just because when I'm checking her MAR here, I see that she doesn't have any other injections, and so that'll be a safe side for me to give. So comparing the orders to the MAR, the MAR calls for digoxin again, 250 micrograms PO once daily. I'll be giving that at 11:15. It calls for vitamin B12, 1,000 micrograms intramuscularly. I'll be giving that via deltoid at 11:15. And it also calls for Levemir, 10 units subcutaneously. I'll be giving it at 11:15 a.m. in the right upper quadrant. All this goes to the patient Jamie Wheeler. Her allergies are codeine, but that won't have any contradictions to any meds that I'm giving today. Okay, so I've prepared my equipment already. I've got a 1 ml syringe with a blunt tip needle, as well as a 25 gauge 5/8 needle. This is going to be for the IM injection in the deltoid for the vitamin B12. I've got a insulin needle here that's going to be measuring 10 units for my Levemir. That's a high-risk med, so when the time comes, I'll have my evaluator double check that. And then I also have 0.25 milligrams of digoxin, and that'll be for her heart failure. It's an oral med. 0.25 milligrams is equivalent to 250 micrograms, which is what the calls for. None of these meds are expired. This one expires, the digoxin expires November of 2036. My vitamin B12 here. Well, first I'll do Levemir. This expires December of 2030, and my vitamin B12 expires December of 2030 as well. Okay, so that's my checks in the med room. That's my first check. I'll be going outside the patient's room now, and I'm going to go ahead and do my second check. Again, checking the provider's orders, and then I'm going to go off the MAR. It calls for digoxin 250 micrograms PO or by mouth once daily. I'll be giving it at 11:15, and it goes to Jamie Wheeler. Again, Jamie Wheeler will be getting some vitamin B12 intramuscularly. That'll be 1,000 micrograms, and I'm going to give that into the deltoid at 11:15. And finally, she'll be getting a subcutaneous Levemir, 10 units, and I'll be giving that in the right upper quadrant of her abdomen at about 11:15. None of these drugs are expired. Again, digoxin will be expiring November of 2036. The Levemir will be expiring December 2030, and the vitamin B12 will be expiring December of 2030. So I will knock on the door and in my patient's room introduce myself. My name is Ringdahl. I am a student nurse, and today I'll be giving you some medications. I'm going to shut the door to provide privacy. And I'll be washing my hands. While I'm washing my hands, I'm going to ask the patient to confirm her name and date of birth. I'm looking at her armband here, and I see that her name is Jamie Wheeler, so I have the right patient. And her date of birth is 10/31/1947. I'll cross-check that with the MAR. The MAR says that the patient, Jamie Wheeler, shows the birth date of 10/31/1947, so I do officially have the right patient. And finally, here I'll do my third check at the patient's bedside. So I've got Levemir. I'm going to give 10 units of this subcutaneously in the right upper quadrant at 11:15. got some vitamin B12. I'm going to give 1,000 micrograms of this. There's 1,000 micrograms in 1 milliliter. And I'm going to give this intramuscular into the deltoid. Normally it'd be ventrogluteal, but for the sake of this, I'll be doing it in the deltoid. And I'll be giving that about 11:15. And finally, I've got my digoxin here. It's an oral med, and I'll be giving that. It's 0.25 milligrams, but that's equivalent to 250 micrograms. I'll be giving that by mouth to her orally at about 11:15. And the reason I'm giving it again is because she has a heart rate of 79. None of these meds are expired. Again, 11 digoxin will be 11/2036. That's expired. Vitamin B12 and the levemir are going to be December of 2030. So now I've got all my meds prepared. I've done all my checks. I can don my gloves and I can start actually administering the meds. My patient's bed is shorted. I'll come over here and see if I can't get it up real quick. Okay, I'm gonna raise Jamie Wheeler up to a working height. And since I'm giving an oral med, I'm gonna help sit Jamie Wheeler up so she can receive this med. Okay. So to prepare the med, I have my hands are washed, down my gloves. Now I'm going to take the digoxin. I'm going to let Jamie Wheeler know. Ms. Jamie Wheeler, I'm giving you some digoxin, 250 micrograms of it to be exact. This is for your heart failure. What it's going to do is it's going to actually help your heart beat stronger. It's also going to give more time in between heartbeats for your blood to fill. It should increase your cardiac output. Some side effects you could have are going to be like nausea and vomiting. So I would get some water in a cup. I've got an oral med here. I would offer Jamie the med with some water. When she'd finish that, I would check, Miss Wheeler, can you open your mouth so I can check under your tongue to see if you swallowed the pill? She did, and so that would complete the oral med. Next, I'm going to move into starting the injections. I'm going to actually fill in both, but I'll start with the subcutaneous when I actually administer them. So I'm going to clean them and allow them to dry. So first, I'm going to start with the vitamin B12, 1,000 micrograms, which is 1 milliliter. So I'll prepare my syringe here. This is actually the ion. Because I'm giving 1 milliliter, I need to draw a 1 milliliter out because I'm using a multi-dose vial. Vitamin B12, injecting it, adding the air, taking it out. Now I'm going to withdraw about 1 mil. I've got some bubbles in here, so I'm going to flick them out. And then I'm going to recap my needle. Now I'm going to switch the needle out to the proper 25 gauge 5/8 inch needle that I'm going to use for a deltoid injection. I know I can use this needle because I'm only giving 1 milliliter of fluid.
I'm going to ask her, but I really think it's not like she forgot to do with the medication.
Next, I'm going to do my high risk drug here. Again, since I'm going to take out 10 units, I got to get 10 units of air to put in there. dry 10 units.
That's like if you like.
Looking out any of the bubbles.
Yeah. It's like you don't want to like.
And before I give this as high risk med, I have to have my evaluator verify it as my second RM. Perfect. And that's all I need. This is going to be for my sub-Q, which is what I'm going to go into right now. So I'm going to expose the area I need. Okay, Miss Wheeler, I'm going to give you some Levemir. This will help control your type 2 diabetes, and this will help control your glucose levels. Some side effects could be pain at the injection site as well as hypoglycemia. So before I give her the sub-Q shot, I'm going to clean the right upper quadrant with concentric circles. Allow it to dry. Get my injection out. I'm going to pinch the skin, and I'm going to insert the shot 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. Okay? This is good. I'm going to go ahead and put this in the sharp. I made sure that I injected that 2 inches away from the navel. Next, I'll move on to the IM injection, which I'll be giving in the deltoid today. Ms. Jamie Wheeler, I'm going to give you a shot of B12 to help with your B12 deficiency, and you may notice some side effects, which will be pain at the injection site. I'm going to disengage the safety. I'm going to clean the injection site with concentric circles. Uncap it. I'm going to find my landmark. I see it. Now I'm going to Z-track. So that's my landmark. I'm going to Z-track the muscle and do my injection. 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. Take this. I'm going to engage my safety on a hard surface, and it goes right in the sharps container. Okay? For both of these, I could put gauze on them. I didn't for the sub-Q, but I should have. For this one, I'll put the gauze on this one. And apply some pressure. Okay. So that completes all the medical administration that I've done. Okay, Ms. Wheeler, so since I gave you a shot of vitamin B12, I should see a reduction in vitamin B12 deficiency. Since I gave you a Levemir subcutaneous shot that'll help control your diabetes, I should see regular, start to see regular glucose, blood glucose levels, no hypoglycemia, no hyperglycemia. And since I gave you an oral digoxin, I should see that you have better cardiac output and less severe congestive heart failure symptoms. I'm going to stay with the patient just for a little bit to assess for any adverse reactions. I've washed my hands. I'm going to make sure that Ms. Jamie Wheeler is in a comfortable position, and I will lower her down, which I'll have to come around and do. While I come around and do this, my final thing is that I would document that I gave digoxin 250 micrograms orally, PO, at 11:15. I gave vitamin B12 intramuscular to the deltoid at 11:15, 1,000 micrograms as per the order, which was 1 milliliter, and then I gave Levemir. I gave 10 units of that subcutaneously to the right upper quadrant of the abdomen at 11:15, and all this went to Jamie Wheeler. That concludes my